Welcome to the Health Focus Podcast, brought to you by Memorial Healthcare, where we discuss current trends and topics in healthcare that are important to our local Shiawassee community. We are coming to you from the Now Building and our podcast studio. As always, I will be your host, Dr. Flermone, a general surgeon here at Memorial. With me here today is Marie Spees, a physician assistant who runs our wound care center. Today, we're going to be talking about wounds, when to see the wound care specialist, and what you can do at home. Marie, thank you for joining us.
Well, thank you for having me.
Why don't you start by telling us a little about yourself, your specialty, why you got into it, kind of what led you down this pathway.
Okay. Well, I'm a local girl, born and raised just in a neighboring town. I've been a PA for just over 23 years, working here that whole 23 years. I started out working with general surgeons, and so I was working with general surgery group, and one of those surgeons was also a vascular surgeon. So I got board certified as a vascular tech. So I did a lot of general surgery and vascular surgery with that group. And then at that time, 20 plus years ago, wound care was in its infancy. The only places that had wound clinics were the Mayo clinics, the U of M's. Not really much was done with wound care. So back then, the family docs were dealing with their patients that had wounds. And if they couldn't get a wound to heal, they'd send them to our group thinking maybe it was a vascular issue. Well, not all wounds were vascular. So we started seeing a lot of wound care, and the physician I worked for said, we really should learn more about wound care. So that's kind of where I came in. I started going to a lot of trainings around the nation, and I met this wonderful surgeon from Alabama, and he was kind of on the foreground of wound care. His wound clinic saw over 80 patients a day, and so he kind of took me under his wing, and I went down there a couple different times, spent a couple weeks down there, and just absorbed a lot of wound care knowledge. And so then I came home, word kind of got out that we were doing wound care. Eventually got too big for the general surgery practice, and that's when Memorial opened up the wound center. And I've been doing wound care ever since.
That's great. We utilize you a lot in our general surgery world, and we see how busy you are. So you mentioned not all wounds are vascular.
Correct.
Why don't you tell us about what type of wounds are there, what disease processes lead to those, and kind of what you see?
The most common reason we see somebody come to the wound center is venous insufficiency. So they have wounds on their lower legs from bad veins. That's a lot of people don't realize it's an issue, but they could have a lot of leg swelling, achiness, veins, and eventually it causes leg ulcers. Obviously, the other thing that we see a lot of are diabetic foot ulcers. We'll see pressure ulcers, which the old term for that was bed sore. Those are pressure injuries. We see burns and traumas. And traumas are just kind of one of those umbrella terms for could be anything, motor vehicle accidents, ATV accidents, gunshot wounds.
Elderly people who fell down and bruised and tore their skin.
Yes, absolutely. A lot of those. Any type of trauma. We see dog bites, cat bites. I even saw a sweet little 90-year-old lady that was attacked by her pet rooster.
Okay.
So all kinds of things come through.
So you've talked about lots of different types of wounds, and obviously not all of them need to be seen by you. What do patients need to know about, what type of wound do I need to be seen? What can I take care of at home? How would I take care of it?
Okay.
Or primary care can take care of it.
Right. So a superficial wound is a wound that isn't full thickness, so it's just a top layer of skin. Those type of wounds really should be healed within 2 weeks. So if somebody's got a wound that has been there for 2 weeks, not really doing much, those are the type of wounds that maybe it's time to think about coming to the wound center. But like I said, not all wounds have to come to the wound center. We can take care of wounds quite easily at home. But a couple things, and I'm going to just blow some minds here. Okay? And even convincing my own grandma of this was hard to do. Wounds do better if they're kept covered, moist and covered. Everybody thinks leave them open to air. Well, actually, that's the last thing we want to do, especially for a burn. You want to keep that burn moist and covered. Because when we leave, if it's a deeper wound and we leave it open, that tissue dries out and we don't get that skin cells coming across and healing. The other thing I see done wrong at home all the time is people love peroxide. Okay, they're pouring peroxide on the wound. They think it's bubbling, it's working.
It's killing the bacteria.
Yeah.
It's killing other things too.
So, exactly. So if it's an infected wound or maybe you just fell, it's okay to wash it maybe that first time with peroxide. But once we're trying to heal that wound, peroxide actually slows healing. So we want to avoid peroxide. Same thing with betadine, alcohol. I've seen so many things used on wounds at home, but those things are all too harsh. So no peroxide. Dial soap is fun. Good old-fashioned soap and water is the way to go.
And I swear people don't have antibacterial soap anymore. They get these fragrant soaps that smell pretty. Right. Well, it's not doing much because it's not antibacterial. So, okay.
Oh, and one other thing.
Yes, ma'am.
That brings me to another one. Everybody goes to the triple antibiotic ointment. We like to avoid that, believe it or not, because if used over a long period of time, a lot of people will develop a skin allergy to it or irritation. And even a lot of dermatologists will say, avoid the triple antibiotic. There's just too much stuff in there that we can react to. So if you have to, because it's preach, go ahead, keep it moist and covered. One thing you want to look for is getting a hydrogel.
Okay.
It's just a water-based gel. There's no additives. It's just going to keep that wound moist, and your body will do the healing.
So how can somebody make an appointment with you if they have one of these wounds? Do they need to go through their primary care? Can they refer themselves, or is that all insurance dependent?
Nope, we'll let patients pick up the phone and call us directly. The only reason they would have to get a referral through their physician is if they required one through their insurance. But patients can call directly or, again, talk to their physician. And most of the physicians in this area are happy to send their patients with wounds to me to deal with those issues.
And how long is your wait time about now if a new patient needs to get in? Do you know that offhand?
Oh, we're seeing patients within 1 to 2 weeks. Or if, sometimes it depends. Like burns, we like to see burns right away. So if somebody calls and has a pretty bad burn, I'll get it in within 24 to 48 hours.
Okay. Do many burns need surgery? We skin grafts, there's a lot of things that can. Mm-hmm. How do you analyze that, and are there people that you refer out to when they need things like that?
Sure. Thankfully, most burns are first and second degree. First degree burn being like a bad sunburn. Second degree burn, those are the ones that blister and are usually very painful. A third degree burn, which is deeper, usually it doesn't hurt quite as bad after the fact, which is kind of weird. You'd think the more pain, the worse it is, but not necessarily with a burn. The first 24 hours is kind of hard to tell when a burn happens, how deep that burn is. But if it's a second degree burn, those are burns that we're happy to manage here locally. If it's a more extensive burn, kind of depends what percentage of the body surface is burned. And if it's third degree, then we would refer out to a burn clinic.
And what about vascular surgeons? Do you send people there when you say a lot of venous issues?
Oh, we send a lot to vascular because a lot of the patients that we see do have vascular issues. Like I said, one of the most common things we see are ulcers on the legs from the veins not working properly. So there are procedures that are really quite minor. If those valves aren't working like they should, they can go in and ablate those veins, and we see wound healing just take off after those veins are treated. And then on the flip side, sometimes it's arterial disease. A lot of diabetics have bad arterial circulation, so they might need stenting, bypassing, those kind of things. Sometimes wounds will not heal unless we can bring more blood flow down.
Thank you very much, Marie. Is there anything else you'd like to leave our listeners with about wound care and kind of any pearls of wisdom you want to leave us with today?
Basically just kind of what we talked about. Just keep it clean, soap and water, keep it moist, keep it covered. Anything that doesn't heal in a timely manner within 1 to 2 weeks, definitely start talking to your primary care about that or give us a call.
Do you deal with things like lymphedema or things along those lines that can lead to more chronic wounds as well?
Yes, absolutely. Memorial is lucky that we actually have a lymphedema clinic here. We've got at least 2 different therapists, I believe, that do the manual massage. Very few facilities have that. But sometimes those patients come in with a lot of extensive wounds. There's a lot of wound drainage. So we'll try and manage those wounds first and then get them over to lymphedema clinic.
Well, Marie, thank you very much for joining us. And as always, that brings us to the end of our episode. Thank you for listening to Health Focus. If you've enjoyed our show, please make sure to rate and review us wherever you listen to your podcasts. This is Dr. Flermone saying thank you, and we'll talk to you soon.